When I first started with Experity 10 short months ago, I had no idea the team that I was joining. I am so excited for you to get a little peek behind the curtain of these great innovators that work every single day, doing what they can to make the urgent care space that much better. So join me today on DX the podcast as we hear from the great innovators at Experity. Lyman is a market-proven product leader and serial entrepreneur whose vision and drive have powered multiple companies and products used by millions. With deep expertise in lean and agile development, he excels at leading high-performing product teams that deliver meaningful user value. Currently serving as Senior Vice President of Consumer Strategy and Innovation at Experity, he brings a rich background spanning early-stage startups, AI practices, and enterprise product leadership. Welcome to DX the podcast, Ian.
Thank you.
Yeah,
Good to
so
be here.
excited to have you here. Kind of surreal. We're here in the AI house.
Yeah, it's finally exciting to be here. I've been hearing about this place from our Seattle compatriots for a while, and it's
Awesome.
really exciting to be in here finally.
You can kind of feel the energy, right? There's people coming and going, all the work being done here. I'm sure this is something you're kind of used to, though.
I mean, this reminds me. This is exactly what I was hoping. Right? It's kind of a cool co-working space with. It's much bigger than I expected. There's a lot of. I guess that's a testament to the excitement around AI. But there are a lot of startups.
For sure.
For sure.
Well, most people in urgent care maybe aren't thinking about AI in the way that you do. So you apply it, extensively as you think about your thought processes of what direction should we go with different opportunities. So I want to kick off our conversation with what maybe seems like a simple question, but really it isn't very simple. Why is AI such an important approach that we tackle in urgent care today?
I think this really cuts to the heart of kind of two things. Number one is just healthcare itself and like what the nature of, a human trying to get healthcare from another human, from a provider or a doctor or nurse is about. And then also the nature of urgent care, which is that it is, it's supposed to be urgent. It's supposed to be kind of fast and responsive to whatever's going on. And, if you think about at the heart of trying to, work with a provider to receive care for whatever's going on with you, it's a communications problem. Yeah. It's, trying to translate a bunch of, complex symptoms and feelings and information about what's going on, with you and as the patient in a very personal, the most personal way. It's things that are happening like inside your own body. You have to somehow communicate that to another human, and often through multiple layers of other humans, in order for them to make some sort of assessment about like what you need, what kind of care you need.
What's actually going on?
And in the context of urgent care, that's supposed to happen like quick, right? That's supposed to happen like now, not next week or some other time. So, how I guess looking at current state or like how does that normally work? It's like we have a chain of humans and pieces of paper and forms and many different like layers of things where you're trying to take that information, all that about health and move it kind of to the next step in the chain and not lose context or make mistakes or any of those things. So you look at AI and it's like, finally, like here's a way where we can, that's kind of because AI, these large language models were trained on language.
Yeah.
Like that's what they do. They're great at understanding language, understanding kind of the nuances of human language, and then taking that information, structuring it and moving it to the next part of the chain. We've never had that before. Like that's fundamentally new. So to me, like that's, I think a lot of people look at AI and think about all the different ways that it could be used. But the first time as a someone that builds products for consumers, mostly the first time I ever, came into contact with large language models, I was like, this is it, right? Finally, we can communicate with technology in a way that we've never been able to before.
Yeah. And that recognition of how it can apply to what has historically been a very antiquated industry, such as healthcare. I love the fresh take that, the consumerism mindset brings to healthcare because it's so needed. And being a clinician myself and recognizing all of these steps along the way that have just been broken for so long. So,
I want to like add on to that for 1 second, because I think and maybe this is the other reason I think it's so important, is that you think about, looking at the antiquatedness of the approach to healthcare. There's a separation between what people think of as patient engagement and then the work that goes on in the exam room with the clinician.
Yeah.
Why are those different things?
Right.
It's all about pulling context and pulling information from the patient and communicating upstream. I think that's the other really exciting part of what AI offers is bringing it all together.
Yeah. Exactly. Yeah. Well, we've kind of talked before about back in the 80s and 90s, technology, digital tools, they were all introduced into healthcare with kind of this expectation that they'd make things easier, better. But in reality, they
Yeah,
just
it's terrible.
didn't,
It
right?
didn't.
So, how is AI kind of unraveling the challenges that those technology steps actually caused us, right? We call it kind of death by a thousand clicks in healthcare. How is AI now stepping in to say, turning this back around and saying, like, how can we get away from that death by a thousand clicks?
And that's really the key, I think. It's like we brought all this technology to the table because the technology theoretically, right, is going to make it easier for us to retain the important details, the important context about a patient's health. And we can put it in a database. We can, put it inside an EHR and EMR, and now it's there. It's like we have a source of truth. But how do you get it there? You're doing it through clicks and form fields and
Yeah.
buttons and all these things. And so
Very non-human
that's
process.
right. You're putting this user interface on the EHR right in front of the provider. And so now the provider is spending all their time clicking buttons and looking at a screen rather than looking at the patient. So weirdly, by adding all this technology to healthcare, which we're trying to make it better, we took the human out.
Yeah.
And strangely enough, I think by adding artificial intelligence into healthcare, we're actually going to be making healthcare more
More
human,
human.
which is a very odd way to think about it. But
Yeah.
I think that's what it is because it allows us to, A, communicate in a way that everyone already knows how to communicate is
Yeah.
with language. And then B, the provider is no longer going to be, tethered
Yeah.
to this screen and the way that they are now, where they're spending all their time clicking buttons and they're actually able to, have a conversation.
Which for many clinicians will feel completely revolutionary. I, for one, have only lived in like what I would call the digital age of healthcare. Whereas there are clinicians that are still practicing that had that experience of less technology. And now it's kind of coming full circle to kind of allow the technology to take away that extra layer that's been between them and the patient for the last several
Right.
decades.
This is the beauty of AI, right? It's the technology that can operate itself rather than relying on the clinician to do the
Yeah.
operating. And
Yeah.
like that's
Which has been a barrier over the years for many clinicians. It's
absolutely.
caused early retirements for many. It's caused heaps and mounds of frustration. So it is really fascinating to think that technology will actually take away the burden of technology.
That's right. I know. It's always been the technology comes with the burden
Yeah.
of being the operator.
Yeah.
And being the operator of technology is often not that fun.
Yeah.
Or it's at least a job into and of itself. And now it's like, okay, I can get back to doing the work that I got into healthcare to do, which is treat people
Yeah.
and care for people. And the technology will just do its thing.
Yeah. Absolutely. So, as a clinician, I personally recognize what you kind of mentioned earlier, which is humans are really the ones that can only truly explain what's happening inside of them. So, buttons, drop downs, rigid forms, that all gets in the way. So, how do you see the actual kind of patient provider interaction changing in as soon as maybe the next 12 to 18 months in healthcare? Just things are moving so quickly.
Yeah, they are.
How do you actually see this change happening and coming to fruition?
I mean, the biggest one is going to be, across the board. I think it's not, hopefully Experity, I like to think we're maybe actually slightly ahead of the game in what we're doing. But I think what you're going to see is, you know, a lot more the idea of the visits is really starting at home. As soon as someone is starting to have some kind of health need or starting to think that they don't feel well, they're going to start engaging with, probably an artificial intelligence of some kind of system that maybe care agent in the case of Experity. They'll start engaging in a way and like, what's wrong? What are you feeling?
Yeah.
What are your symptoms? What do you need? And that, the visit is kind of already started. We're already starting to understand that patient, understand the context around what they're feeling. And because we're doing it with human language and not button clicks, it's like we're not relying on the patient at this point to like in their own mind, oh, I'm not feeling good. Now I have to translate all my feelings into button clicks and form fields, which
Yeah.
that's hard to do. I mean, just the work of filling out the form is one thing, but then trying to think about all the kind of cognitive load and just,
Yeah.
especially if you're, English is not your first language and you're
Sure.
trying to translate it in your mind. Like these are hard steps. And a lot, as we see, I mean, look at the data, right? A lot of people just give up. They
Right.
they never finish or
Right.
their registration is incomplete or
Burdensome,
that's
frustrating,
right.
annoying, all the words you can pick.
So my hope is like that what we're going to see really rapidly is that now we're engaging people more in a familiar way with much more language oriented. I'm not imagining every interaction is going to be like a conversational
Sure.
chatbot thing, but it could be a hybrid where you've got, we're exposing buttons to you at the right time. We're
Yeah.
exposing certain things where it makes sense, but really focused, really responsive, really reactive and dynamic engagement with patients in a way where we can capture that context as early as possible.
Yeah.
We can structure it automatically and we can send it on to the next step in the chain, right into our AI scribe, for example, so that the provider, by the time the patient checks in and walks into that exam room,
Right.
provider fully is briefed on what's happening and the chart's already started and things are underway. So we're
Yeah.
going to see, to me, that unlocks not only a much better healthcare experience and better outcomes, I hope, but such a better experience for the patient. So,
Right.
their satisfaction level is going to go up. And then you think about clinic operations and just how much more efficient those things can get. Now we can see patients at a scale that we've never been able to see before,
Yeah.
but we're not sacrificing the provider to that, right? We're not
Right.
saying,
Which has historically been
you
get
got to
this,
shrink your
yeah,
visit time down.
do
No,
this administrative work, do this, do XYZ to keep seeing more patients.
yeah,
Yeah,
that's right. So
absolutely.
I think it's a super exciting time. I like to tell people I was never involved in healthcare until I came to Experity.
Yeah.
Never really thought that much about it, but AI has really, I think it is the most relevant technology to healthcare.
Yeah.
And I think, healthcare needs this desperately.
Yeah. And I think there's a lot of focus on the provider side, but I love that you brought in even the cognitive load and cognitive burden for the patient. The patient is the one that's sick. They're not feeling well. So how can we ease their, process along the way as well and think of that continuous journey that they're in and come alongside them and help guide them. So, well, this
Yeah.
was fantastic. Really appreciate all your insight, Ian. Thank you for everything you're doing to help improve the patient journey. I love your mindset that you bring to the table and just a fresh perspective. So thanks for being on DX the podcast.
Thank you so much. It's really been a pleasure.
Awesome. See you next time. DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us on the journey.